Now let's talk about this term called as pleomorphism. What is pleomorphism? Look at this picture. Here we have the normal cells in which there is a nucleus. Here also there is a nucleus, and the nucleus are not very prominent. They are normal in size, and even the nucleolus are quite normal in size and shape. Now look at the cancerous cells. All these are cancerous cells. They have prominent huge nucleus. They have coarse chromatin. They have multiple and large nucleolus, and they are undergoing continuous proliferation by the mitosis. So this is the contrast between the normal and the cancer cells. So a normal cell, when becomes cancerous, the nucleus changes in its shape and size. As it gets more prominent, there is huge amount of chromatin present in this nucleus because there is a rapid duplication of the genetic material and the formation of all these mitotic bodies. So the variation in the size and shape of the cell and the cell nuclei is called as pleomorphism. The ratio between the nucleus and the cytoplasm here is less, but in this case the nucleus to cytoplasmic ratio is more. Okay, let me make you understand in this way. So we had this little piece of shit here, and as we said that this is a cancer cell because it did not mature into adult form. Now as we had already termed this baby as cancer cells which could not able to mature into adult form or more differentiated form and retained its ability to proliferate. So if it does not mature, then what will happen to the cell? In what other form can it exist in the body? Because in almost all the cancers, the morphology of the cancer cells from where it originates completely differs from its parent cell or parent organ. So the cancer cell tends to look different. Just like as we have seen here, the pleomorphic cells are different. The cytoplasmic and nuclear ratio is different. So the entire morphology changes. This little cute piece of shit, instead of becoming the mature form, it may grow into something like this, which is completely different from this. Maybe not completely different, just slight variation from the skin color, but still this make a huge difference, either you say in the world or in the body. So as this child has the ability to divide, and if it turns into something like this or changes its morphology, it still has retained the ability to multiply, right? So this thing is called as pleomorphism, or the cancer cell is forming something an entirely different type of cells, which again leads us to the concept of metaplasia, then dysplasia, and then neoplasia. So I think we understood about the pleomorphism and hyperchromatic nuclei and abnormal mitosis. You can look at this picture which is given in the book. So as you can see, this is the normal epithelium where the cells are intact and good. They look good, the nucleus is small, they are arranged in a perfect manner, everything is smooth. But as you go from there to here, and you will see that the shape of the cell itself is changed, the morphology is changed, even the nucleus is huge in all these cells. So one cell might have undergone some kind of mutation which made it anaplastic, and from that one cell it divided and proliferated rapidly into thousands of cells and penetrated inside the tissue, deep inside the tissue. So this thing is called as invasion. Invasion is nothing but the cells getting divided and invading into the other parts or the tissue. So you can just pause and give it a look. Next, here I also want to talk to you about something else which is called as degree of anaplasia. What does that mean?